Basic concepts of anatomy, kinesiology, and the major clinical changes that generate motor disabilities. Kinesiology. According to Hamill 2000, the word kinesiology can be used in two ways. First, kinesiology is the study of describing any form of anatomical, physiological, or mechanical assessment of human movement. A second use of the term is to describe the content of a subject in which human movement is evaluated by examining its source and characteristics. Basic osteology. The adult skeleton has approximately 206 bones that perform functions related to the maintenance of posture, locomotion, protection of the noble structures of the body, and important metabolic processes such as blood cell formation. They are not only rigid structures, but living structures, whose metabolism influences the function and vice versa. They are mainly composed of two-phase materials. The mineral part, resistant to compression, is composed of calcium phosphate and calcium carbonate. The organic part, resistant to tension, is composed of proteins. With age, the skeleton loses water and organic matter and becomes less resistant. The outside of the bones is composed of a compact material and the inside of a spongy substance, the amount of each being related to the need. Like all tissues, bones can change their trophism in response to the loads and functions imposed on them. Types of bone. Long like the femur and has the function of supporting the body and performing ample movement, providing speed at the end of the segment. Short like the carpus and tarsus bones that slide together for the purpose of joint mobility. Flat like the scapulae, whose large flat surface serves to attach muscles and allows sliding on the costal grid. Irregular like the vertebrae, which are bones with specific functions. Bone growth and development. Ossification is the process in which the deposition of bone salts in an organic matrix occurs. It must be preceded by the differentiation of the cell type that will be deposited in the producing matrix. Intramembraneous ossification, which is the deposition of bone salts in a pre-existing connective tissue matrix, such as skull bones, or endochondral ossification, which is done in a matrix of hyaline cartilage as in short bones. Bone tissue has the ability to remodel itself to suit its function. This occurs by deposition or resorption in the appropriate places. The growth of the long bones. Even before birth, diaphyses, centers of primary ossification, appear in the center of the future bone, where ossification occurs in all directions from a pre-existing cartilaginous model. At the same time, a bony ring arises by intramembranous ossification in the periosteum around the body of the bone, defining its outer diameter. One or more ossification centers appear at the ends, which are called epiphyses of growth. Some close even before birth, others only in adolescence until all cartilage is replaced. At the end, only a cartilaginous disc remains that separates the diaphysis from the epiphysis. The most recently formed bone at the end of the diaphysis is called the metaphysis. After bone closure or fusion, only a raised ridge remains at the epiphyseal line. The short bones grow as if they were epiphyses. Fusion time. Under normal conditions, epiphyseal fusion can be considered a clock of a young person's development. However, nutritional or endocrine changes can alter the process. Women generally have their ossification completed about 1 to 3 years earlier than men. The estimation regarding the degree of ossification can only occur accurately through imaging examinations. Ethnic, geographical and hereditary differences have not yet been determined, although they are likely.